Welcome to Beyond the Diagnosis. Today, we are diving into a topic that affects every one of us, whether in the clinic or in our personal lives, yet is often overlooked: musculoskeletal health, mobility, and injury prevention. I am your host, David Kessler, and I am thrilled to introduce our guest, Dr. Grace Cham, a physician and medical consultant with expertise in lifestyle medicine, metabolic management, aesthetic medicine, and evidence-based strategies for functional movement. Dr. Cham has spent years helping patients and healthcare professionals alike understand how small changes in movement, posture, and daily habits can prevent chronic pain and maintain lifelong mobility. Grace, welcome to the show.
Thank you so much, David. It is a pleasure to be here. I think one of the most important conversations we can have today is about how midlife adults, and even physicians themselves, often neglect the foundations of musculoskeletal health. You can exercise regularly, follow a healthy diet, and still develop preventable joint pain or back issues if functional movement, mobility, and strength are ignored. In my practice, I emphasize that prevention is not optional, it is critical. Simple, intentional daily routines, awareness of posture, and targeted exercises for joint stability and functional strength can make a dramatic difference in quality of life. I want listeners to think about their own habits and consider how these principles can be incorporated into daily routines for themselves and for the patients they guide.
That's a powerful statement, Grace, and honestly a wake-up call for many, myself included. It resonates deeply because we often assume that if we're hitting the gym, we're covered. But you're highlighting a distinction there: functional movement. Can you elaborate a bit on what that truly means and why it's different from just exercising regularly?
Absolutely, David. That's a crucial point. When I talk about functional movement, I'm referring to how your body moves efficiently and effectively in everyday life. It's about performing common tasks like reaching for something on a high shelf, bending down to pick up a child, or even just getting in and out of a chair without pain or struggle. Often, people go to the gym and lift weights, which is great for building muscle, but if their foundational movement patterns are flawed, they might be reinforcing those bad patterns or even creating new imbalances.
So you're saying you could be strong in the gym, but weak in real-world movements?
Precisely. Think about it. Like, you can squat a heavy barbell at the gym, but if you can't properly hinge at your hips to pick up a grocery bag without rounding your back, you're missing that functional strength. Our bodies are designed to move in specific, integrated ways. Functional movement training aims to improve those patterns, ensuring your joints are stable, your muscles are coordinated, and your body can handle the demands of daily living without undue stress or injury.
That makes so much sense. It's like building a strong house on a weak foundation. And you mentioned midlife adults specifically. Is there something unique about this stage of life that makes these issues even more prevalent or critical?
Oh, definitely, David. Midlife is a really interesting period. On one hand, people are often more sedentary due to desk jobs, long commutes, and family responsibilities. On the other hand, we start to see the natural aging process accelerate. Things like sarcopenia, which is age-related muscle loss, become more pronounced. Bone density can decrease, and tissues become less elastic. If you combine these physiological changes with years of ingrained poor posture or inefficient movement patterns, you create a perfect storm for chronic pain and injury.
So it's not just about the wear and tear, but the acceleration of wear and tear due to habits developed over decades.
Exactly. Many patients come to me in their 40s or 50s complaining of back pain, knee issues, or shoulder stiffness, and they'll say, "I haven't done anything differently." But what they haven't realized is that those subtle, repetitive, poor movements, or lack of proper movement altogether, have been accumulating microtraumas for years. And then, one day, the body simply can't compensate anymore. That's when the pain starts.
And you also touched on physicians themselves neglecting these things. That's a fascinating paradox. We're the ones advising patients on health, but often we're working long hours, hunched over charts, or in suboptimal positions. What's your take on that?
It's a huge issue and one I'm very passionate about addressing. Physicians are not immune to these challenges. In fact, I'd argue they're often at higher risk. The demands of the profession, long shifts, constant standing or sitting, high stress, poor sleep, all contribute to musculoskeletal strain. I've seen colleagues with debilitating back pain, neck stiffness, and carpal tunnel syndrome, all stemming from their work environment and lack of self-care. It's ironic, isn't it? We preach prevention, but our own lives often don't reflect it.
It truly is. It speaks to the broader challenge of self-care in demanding professions. So let's pivot a bit to solutions. For our listeners who are recognizing some of these patterns in themselves, where do they even start? What are some simple, intentional daily routines or awareness practices that can make a difference?
The good news is you don't need to overhaul your entire life or join a specialized gym right away. Small, consistent changes are incredibly powerful. I always start with posture awareness. Most people don't realize how much their posture impacts their entire kinetic chain. Simple checks throughout the day. Are your shoulders rolled forward? Is your head jutting out looking at your phone? Are you slumping in your chair? Just becoming aware of these habits is the first crucial step.
I find myself doing that all the time, especially when I'm deep into emails. It's almost involuntary. So once you're aware, what next?
Once you're aware, try to gently correct it. Think about stacking your joints, ears over shoulders, shoulders over hips, hips over ankles. It's not about being rigid, but finding that natural alignment. Then, incorporate movement snacks throughout your day. Instead of sitting for hours, set a timer for every 30 to 60 minutes. Stand up, walk to get water, do a few gentle shoulder rolls, or perform a simple hip hinge. These micro breaks are vital for circulation, joint lubrication, and preventing stiffness.
Movement snacks. I love that. It makes it sound less daunting than take a break and do a full workout. What about specific exercises that can target joint stability and functional strength without requiring a gym?
Absolutely. Let's focus on a few key areas that tend to be problematic for midlife adults. First, hip mobility and strength. Our hips are the powerhouses of our body, and prolonged sitting really tightens them. Simple exercises like glute bridges, lying on your back, knees bent, lifting your hips off the floor, or leg swings, gently swinging your leg forward and back, side to side, can make a huge difference. These improve hip extension and rotation, which are crucial for walking, running, and even just standing comfortably.
And these can be done just about anywhere, in a living room, an office.
Exactly. Next, upper back and shoulder mobility. With so much time spent at computers or looking down at devices, our shoulders tend to round, leading to neck and upper back pain. Exercises like wall angels, standing against a wall, trying to press your arms, elbows, and wrists against it as you slide them up and down, or simple resistance band pull-aparts can counteract this rounding and strengthen the postural muscles.
I can feel my shoulders relaxing just thinking about those. And I imagine core strength plays a huge role in all of this as well.
Oh, absolutely fundamental. A strong core isn't just about six-pack abs, it's about a stable trunk that supports your spine and allows for efficient movement of your limbs. Simple planks, bird dogs, where you extend an opposite arm and leg while on all fours, and dead bugs are fantastic for building functional core strength without putting undue strain on your back. These exercises teach your deep core muscles to engage and stabilize.
So it's about integrating these small, targeted movements throughout the day rather than waiting for a dedicated hour-long gym session. That feels much more attainable for busy individuals.
Precisely. Consistency trumps intensity, especially when you're starting. 10 minutes of focused, intentional movement every day is far more beneficial than an hour-long session once a week followed by 6 days of complete inactivity. It's about changing your baseline level of movement and making it a non-negotiable part of your routine, like brushing your teeth.
That's a great analogy. And what about flexibility versus mobility? Are they the same thing, or is there a distinction we should be aware of?
Excellent question, David. They're often used interchangeably, but there's a key difference. Flexibility refers to the passive range of motion in a joint. Think about how far you can stretch a muscle. Mobility, on the other hand, is the active range of motion. It's your ability to control a joint through its full range of motion. So, you might be flexible enough to touch your toes, but do you have the strength and control to maintain good posture throughout that movement? That's mobility. You need both, but mobility is arguably more important for functional health and injury prevention as it incorporates both flexibility and strength.
So it's not just about how far you can stretch, but how effectively you can move through that range. That adds a whole new layer of understanding. Are there any misconceptions about pain that you often encounter in your practice when it comes to musculoskeletal issues?
Oh, many. One of the biggest is the idea that pain means you've done something wrong or that you should completely stop moving. While acute pain certainly warrants rest and careful evaluation, chronic pain often benefits from guided movement. Fear of movement can actually make pain worse over time as muscles tighten and joints stiffen. Another huge misconception is that pain is normal as you age. It's common, yes, but it's not normal. We can absolutely mitigate and often eliminate much of this age-related pain through intelligent movement and lifestyle choices.
That's a powerful message of hope for many listeners, I'm sure. It really emphasizes the proactive approach. You mentioned earlier the physician paradox and the challenges healthcare professionals face. Do you have any specific recommendations for them, considering their unique work demands?
Absolutely. For my colleagues, I recommend really emphasizing micro breaks and intentional movement. When you're dictating or charting, take a minute to stand up, do some scapular squeezes, pinching your shoulder blades together, or gentle neck rotations. Invest in ergonomic equipment if possible, like a standing desk converter. And critically, prioritize your sleep and stress management, as both significantly impact your body's ability to recover and repair. Remember, you can't pour from an empty cup. Your ability to care for patients hinges on your own well-being.
Such important advice, not just for physicians, but for anyone in a high-stress, sedentary role. Let's talk about the long-term benefits here. Beyond just preventing pain, what does this focus on functional movement and mobility ultimately offer people in terms of their quality of life as they age?
The benefits are profound, David. It's about maintaining independence and vitality. It's about being able to play with your grandchildren without worrying about your back, to pursue hobbies like gardening or hiking without joint pain, and to simply live a full, active life well into your later years. It reduces the risk of falls, improves balance, and enhances overall physical confidence. It's not just about living longer, it's about living better, with more joy and less limitation.
Living better, not just longer. That's a beautiful way to put it. For someone who feels overwhelmed by where to start, perhaps they've been sedentary for a long time or are already experiencing some aches, what's the very first, smallest step they can take tomorrow?
Start incredibly small. Don't aim for perfection, aim for consistency. Pick one thing, either 5 minutes of gentle walking every hour, or 5 minutes of dynamic stretching in the morning, or simply stand up every time you take a phone call. Just one small, intentional action that gets your body moving differently. Track it for a week and then maybe add another small habit. Progress, not perfection, is the key. And remember, it's never too late to start improving your musculoskeletal health.
That's incredibly encouraging advice, Grace. Progress, not perfection. I think that's a mantra we all need to adopt. Dr. Grace Cham, this has been an incredibly enlightening and practical conversation. Thank you for shedding so much light on such a crucial, yet often overlooked aspect of our health.
My pleasure, David. Thank you for having me and for giving this vital topic the platform it deserves. I hope listeners feel empowered to take those first small steps towards a lifetime of better movement and health.
And thank you, listeners, for joining us on Beyond the Diagnosis. We hope you feel inspired to make those intentional changes in your daily routines for a more mobile, pain-free future. Until next time, stay healthy, stay curious, and keep moving.